Hi, I'm Dr. Ansel Johnson, Clinical Director of Vision Salon Eye Care Associates, and we are so excited. Dr. Shannon is here with me today, and we're going to talk about a fantastic new service that we're bringing into our office. As Clinical Director, I brought Dr. Shannon in as Director of Myopia Management, and myopia or nearsightedness has been an epidemic in this country, and it's even worse with COVID. Our children doing so much reading on a computer, and they're just stuck, and their glasses get worse and worse every year. So you as a parent, if you've been concerned about your child, their glasses getting worse and worse every year, I'm going to let Dr. Shannon tell you about the program, but we are so excited, and this is going to be life-changing for so many of our children in this country. And again, we're excited and happy to have her on board and to tell you about our myopia management program.
Well, thank you for your nice introduction for me, Dr. Johnson, and I'm very excited to be on board with Vision Salon Eye Care Associates. So just to talk a little bit about myopia. So myopia is the clinical term for the layman's term of nearsightedness. So many students, many children, many adults are nearsighted. There is an epidemic, as you had mentioned earlier. The epidemic of myopia, we are seeing that the myopia rates are nearly doubled in comparison to in the 1980s and 1990s in today's world. So that's an issue. The issue is because there's so many of our children that are now having to wear glasses and are really dependent on that for their academic success, maybe sports success, and so on. With myopia can have a lot of its risks. Some of those risks are long-term, but some of them can make it difficult for kids to see, to enjoy their lives, to swim, to play tennis, to play basketball. So those are some of the short-term issues, but let's talk about the long-term issues with myopia. Myopia puts kids at a higher risk of what we call myopic macular degeneration. That's a permanent disease. That's a permanent issue that cannot be treated. The reason that myopia is an issue is because it's causing the eye to be longer.
It's such a huge epidemic, and again, for so many years, we couldn't figure out what to do. And now we have so many new tools. Now, let me tell you a little bit about Dr. Shannon's qualifications, because she might look young, but she is highly qualified. And one of the reasons we're so blessed to have her on board, this young lady was one of the first interns actually to work in my office while she was in optometry school, her last year of optometry school. And I saw then the potential that she has, the next level thinking as an optometry student that she has, the self-starter and the expertise. And everywhere that she has gone, she's been quite impressive. She's got so many awards and scholarships while she trained at the University of Alabama, Birmingham, right?
Yes.
And we can go into her whole background from high school, which we'll skip right now. But anyway, that's a private joke we have, to undergrad college, and she was a Division I tennis player, folks. Division I. So to be disciplined to play sports at a Division I level and still excel academically just speaks volumes to her, her academics and her intellect. And again, in optometry school, she won a number of national awards and scholarships. She interned here, but after graduating, after receiving her doctorate degree, she was the first optometry fellow at the University of Chicago hospitals. So there's only one first, and she excelled there in her residency at the University of Chicago. So we were able and blessed to snatch her up after her residency program at the University of Chicago, where she did outstanding. Everywhere she's gone, she's been extremely impressive. So we brought her here, and this is her passion, helping people not have all of these long-term side effects from having very, very strong eyeglass prescriptions. And a lot of times we as parents, we see our kids, their glasses get thicker and thicker every year, and we wonder, what can we do? And we tell them, and I've told parents this there's not much we can do. There are a few things we could do with, vision therapy, but now technology has brought so many different tools that we can manage these patients so that they don't have our children, so that they'll live as adults feeling unsafe if they were to lose their glasses and being able to function. So Tell us about some of the tools that we have to work with our children that you use to manage their myopia or nearsightedness.
Yes, absolutely. So right now we have three evidence-based tools that we can use to slow the progression of myopia. So there have been many studies that have already been performed over the past 20 years or 2 decades of research that shows that myopia can be slowed, the progression of it. One of those tools, and this one came out back in 2019, is called the CooperVision MySight One-Day Contact Lens. So how this contact lens works, it's easy to fit. We fit it the same way that you would for a regular adult of a soft contact lens. Nothing really complicated as far as handling and cleaning and using it. And what's nice about this lens is if parents are concerned about their children not being able to clean their lenses or do a good job with wearing them, it is a daily disposable. So they put it in, wear it for the day, and they throw it out at night and open up a new one the next day. So it's a very hygienic, very safe lens. And the benefit of this lens is that the design, it's specially designed to have light bend in a way that slows the progression of myopia.
So Dr. Shannon, how young can a child be that we can fit with this MySight?
Well, the studies that have been done for the children for the MySight lens we're in the age range of 8 to 12. But there are children that have been fit with this lens as young as 6. So this is, as long as your child and as a parent, if you're very involved with it, then the child shouldn't have any issues. But again, the studies that were done in children between 8 and 12 years old. So even your little 8-year-olds that you might be worried about can still safely wear this lens.
Wow, fantastic.
So we have other options now. There's also a therapy called orthokeratology. Now the beauty of orthokeratology, and I'll show you these two. There's two different companies, but we fit the Ability lens by Johnson & Johnson, which was just released last year, and the Paragon CRT lens, which has been around for a very long time. Both technologies are FDA approved, and they're excellent options for children as well, between the ages of 6 to 12. Again,
you could fit a 6-year-old with contact.
Yes, you can.
I'm telling you, wow, a 6-year-old with contact lenses. Okay.
Yes. So let me tell you a little bit how the orthokeratology lenses work. They're beautiful. They're amazing, and they're almost like magic. The way that they work is you sleep, and the contact lens is only worn overnight. So the child sleeps in the lenses, and when they wake up in the morning, the lenses are removed. So they stay at home, and they're able to see clearly throughout the day without the dependence of their contact lenses or their glasses. So this is great for your active ones that love to swim, that maybe play football or basketball, different types of activities that you might be concerned about a contact lens maybe falling out, or maybe them losing their contact lenses, because these lenses, the orthokeratology, will stay at home safely so that they're not lost.
Wow, that is so it's almost like when you wear braces and you wear a retainer at night, right? So this is the same sort of principle with contact lenses. So overnight, they're working magic, readjusting the prescription of your eyes so that during the day, you can be eyeglass and contact lens free.
Exactly.
Is that correct?
Yes, that is very true. And we've actually fit one of our technicians here, Mike. He's done an amazing job with these lenses. So it works. We're very excited to bring this into our practice and offer this service. There's a third option. The third option is more usually for the ones that are a lot younger. It's low-dose atropine. So low-dose atropine has been shown in studies to also slow the progression of myopia. It's an eye drop that children are using at bedtime.
So, Doctor, what is this? What it's called? Atropine.
Atropine. It's called atropine.
Now, tell me about that a little bit. Is there any side effects or anything you should worry about? Okay.
Yes. So similar to our, when you come in for an exam and you get your eyes dilated, atropine is a dilation type of drop. So some of the side effects of atropine can be, enlarged pupils. There may be some light sensitivity. However, in the studies that have been performed for atropine, in regards to children with atropine, these side effects are actually pretty minimal. And we can adjust the concentration of the drop so that it allows children to, be able to tolerate it a little bit more if necessary. I do not recommend this treatment for children that are kind of in grade school. So once they hit about 6, 7, 8, or even older, do not recommend atropine as an option. However, it can be used in combination with our MySight lens or orthokeratology lens because it may possibly help slow the progression even further.
Wow, that is such great. Because I was wondering, now for those children that kindergarten, because we see kindergartners wear glasses, right? First graders wear glasses. Those very young children, this may really be not the drops, right?
Yes.
So, but also from what I understand, because you are our myopia management expert, of course, but this drop called atropine, it's a very, very low concentration because we use it for other things in eye care, for dilating eyes, eye pain, things of that nature. But from what I understand, this is a very, very low dose drop.
Very low dose, very low dose. So typically the dosage that we use for dilation or any treatment of like uveitis, inflammation of the eye, that one is a 1% dosage. This drop is a 0.05% or lower for the use of atropine. So the risks, the side effects are really, really minimal in comparison to the everyday atropine that we would use for older patients or patients with more severe conditions.
Wow. So, folks, we have a number of tools that we are so excited about to bring this type of eye care in, especially a practice like ours with our demographics, because our practice is so very diverse. African Americans, Latino, we have Indians, and Anglos, people of European descent also. So we're proud of our diversity of our office, but a lot of times in communities of color, we don't know about these cutting edge technologies and treatments that are out there.
Not at all.
And with that being said, is this something that your insurance will cover?
No. So unfortunately, the insurances are not quite yet on board with it. Reason being is because it's so new. It's a newer treatment, newer technology. I think that insurances tend to lag behind by about 20 years in some cases as far as taking on or adapting to new technologies. So this is a service that is out of pocket or it can be covered with care credit. So there's different ways that you can afford this treatment for your child.
Yeah, and we have there's several different medical savings accounts that you may put away for family expenses that may cover your deductible that you use for medications. They may very well cover something like this. But we want parents to understand, you just like for paying for braces and things of that nature, this can be life-changing for a child. Because when your prescription is so very, very strong, that limits you in terms of some certain careers that you can do later on in life. So just be aware of that, and safety is an issue. And it hurts me as a parent to see children's eyes get worse and worse and worse. And now we are empowered, we have the technology. So when you consider that, just think about you're investing in the health of your child, right? Their eyesight. Sight is such a very precious organ. It's a precious sense. Now, we also have a not-for-profit. I do want to mention Healthy Living with a Vision, healthylivingwithavision.org. And what we're doing, we're actively raising funds to help provide scholarships for those parents that may not be able to afford our myopia management. So if you are considering that, we would ask that you consider donating so we can help provide scholarships for people with myopia management. So our website is www.healthylivingwithavision.org. I'll put it on the bottom here, and be sure to check out our website and mail in a check. Any donation will be welcome, and you want to earmark that for myopia management so we can help more people in our community, more of our children in our community. So anything else you want to say on closing?
Just to say that, I'm very excited to offer this service. We are very excited to offer this service.
Yes,
and we hope that parents are really out there listening and understanding. And I hope that you do your own research and look into myopia management. This is a newer treatment option. We did not have that, myself and Dr. Johnson, as we were growing up. So every year our prescription just changed, and had to get stronger and stronger glasses. That option is going to change if you are able to, get that treatment for your child.
Well, thank you very much. Welcome to Vision Salon Eye Care Associates. We are so happy. She's been here for a while, but we are so happy. Patients love her. Our patients want to see me. They see Dr. Shannon's like, hey, can I still see that younger doctor over there? So, but that's okay. Either one of us. But and Dr. Leonidas Johnson that comes in and helps us out. But we are so happy. Again, this is a life-saving, life-changing type of service that we're so excited about having. So, as I always say at the end, we want you to be well, see well, be blessed, and see you soon. Oh, if you want to make an appointment, our phone number is 708-385-0013, 708-385-0013. And if you're interested in myopia management, you can set up an appointment or consultation with Dr. Shannon. Visit our website at visionsalon.com. So all that stuff's going to be on the bottom here. So take care, be blessed. Bye-bye.
Take care.